Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you if needed. But I like to always get into my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Question number one states, what ethical term is defined as independence and individual's free will? Is it A, veracity, B, dignity, C, autonomy, or D, justice? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first. Here, the stem of the question is the question. The question is the stem. So, what ethical term is defined as independence, an individual's free will? Y'all know I always tell y'all with non-clinical, you got to know the definitions, know the terms. And my thing that I always tell y'all is repetition is the key to retention. Do it over and over again. Write it out, do flashcards, quiz yourself so that you can keep it repetitively in your mind, right? But the answer for this is C, autonomy, okay? C, autonomy is independence, an individual's free will, okay? Question number two, the nurse practitioner is assisting with clinic research by measuring the percentage of decrease of a patient's A1C level after incorporating lifestyle modifications. What type of research is this? Is it A, randomized control trial, B, qualitative research, C, quantitative research, or D, relative risk? Take a moment and tell me what you got in the comments. All right, so here some of the question states, what type of research is this? All right, so let's see what they're talking about. So the nurse practitioner is assisting with the clinic's research. They're measuring the percentage of decrease of a patient's A1C level after incorporating lifestyle modifications. Okay, so randomized control trial doesn't really mention if things are randomized or not, so we'll just hold that to the side. Qualitative research, not so much. Quantitative research, yes, C is the best answer. Quantitative research. Think about what quantitative research is. Quantitative, I always say think of quantity. It's numerical, it's a measurement. It's typically research that we're doing and we're measuring specifically. Qualitative is more things that we're getting quality details like interviews, okay? So, best answer here is C, quantitative research. And then lastly, question number three, the patient is inquiring about adding dental coverage with his Medicare plan. What part of Medicare is this? Is it A, Part A, B, Part B, C, Part C, or D, Part D? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, what part of Medicare is this? All right, so we know we have our Medicare A, B, C, and D, but the patient is inquiring about adding dental coverage. So when you think of the different plans and what is included in each part, we know Part C is the choice plan, and that's the one where you can add in vision and dental coverage. Part A, I say that's automatic. Think A for automatic. So when they're 65 or have any of the disability criteria, then they automatically get the baseline services. Part B, the basics of outpatient style things, your labs, your surgery, your DME equipment. Part C, the choice plan, again, adding in the dental and vision. And then Part D, think drugs for prescription coverage, okay? All right, you guys, I'm trying to just incorporate some of these non-clinical style questions to help you guys prepare and see it in the fashion of question types. So as you're reviewing, I know it can get kind of redundant with all of the topics and learning the terms. So just trying to show you how to apply it to those question types, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. Also, I'm going to be doing, because I see all of y'all starting to subscribe, and I really appreciate all of y'all and your feedback. I'm going to do something for the subscribers soon, either a discount, a free class, or a review source. I'll come up with something, but be on the lookout. Also, if you need any of the resources that I offer, feel free to reach out to the Nursing Studio. Give us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one, at gmail.com. Things that I do offer is my review book. You can either get it in an ebook, which will provide you access on any device as soon as you purchase, or you can get the paperback book from Amazon shipped to you. Both of these are linked in the bio of this channel. It is broken down by system, designed for family and adult gero. It's short and sweet. I break it down in the way that I always teach you guys: assessment, diagnosis, evaluation, and treatment. And then I have an interactive section for you to fill in the blank in all of those areas to quiz yourself after reviewing it for each system. And then there's also practice questions with rationales at the end. Next, I do have a self-paced independent review. It's on demand for family and adult gero, designed for both exams. That's also linked in the bio of this channel. Our upcoming 5-week review will be in September, so be on the lookout for enrollment for that. My one-on-one sessions, I always say reach out for this because they're so customized. You can either book a session to cover 1 to 2 weaknesses during the sessions. You can book an exam readiness assessment, or you can book the most popular one, which is the custom plan. Where you are provided a pretest. I gauge where you are to see what your strengths and weaknesses are. And based on the allotted time that you would like to review to prepare for boards, I will design and structure a study plan and work alongside with you during that time, and then get you prepared to have a successful test attempt. Also, I have one more VIP enrollment available for August and September. This is typically designed for someone who has had difficulties on boards before. You can't figure out what to do differently, need a little bit more detailed structure, and working alongside with you with repetitive action and things with my courses. It is an 8-week course, VIP, directly with me throughout to get you from unsuccessful to successful. I only have one of those slots available. I'm already doing one. And like I said, I a lot to that, a lot to it. And so I don't take on many people for my VIP, but I do have one more available. So if you're looking for any of those resources, just reach out to the Nursing Studio. But y'all make sure to meet me back here. Happy studying. Bye, y'all.